This is Stock Day. News and interviews from the microcap world. Public information on the OTC, pink sheets, and microcap stocks from around the world. With your host, Everett Jolly.
On today's show, we have a very exciting guest with us. It is Tony Dudzinski. He is the COO of American Cryostem Corp, trading under the ticker symbol CRYO. Tony, thank you very much for coming on the show today.
You're welcome, Everett. Thank you so much for having me.
Hey, tell us a little bit about Cryostem. I know there's been a lot of talk about different stem cells in your marketplace. What makes your company so special?
Well, what we provide essentially is a very easy to access platform for any individual interested in stem cells or stem cell therapies to use their own cells in their own tissues for those therapies. So our company, which was founded in 2008 and became public in 2011, we've developed a method where we have a network of physicians around the country who collect tissue from their patients and then send it to us where we process it for future use. And that would either be for cosmetic procedures, say if they're doing tissue transfers, for usually women who are a little bit older doing facials and hands and breast augmentations. And then also we take that same tissue and can process it and derive the stem cells. And we picked adipose tissue because everybody has a little, even myself, and because it's very accessible. You can actually have a tissue removal procedure done on your lunch hour and go back to work. It's very easy to do. And the quantity of stem cells in fat tissue is about 500 times that of other tissues in the body by weight, by gram. So it's easy, it's accessible, anyone can do it, and then you can ensure when you do need a stem cell treatment or you do want a stem cell treatment that those cells that you're getting back are yours and are genetically matched to your body.
Now, that sounds great. It almost sounds too scientific for me to even comprehend. My question to you is that we take the fat cells, if you will, the adipose tissue, we send that to your lab, if you will, and what's the cost on this? Can a normal person afford this? Are we talking hundreds of thousands of dollars?
Oh, no. This is really a simple procedure. So usually a doctor will charge about $1,000 for the procedure, for his time and his space. And then we at the company will charge $985 to process the first 100 milliliters of tissue, which is about 4 ounces, a quarter of a cup or so. And then we will, there are, the prices go up a little bit. If you want larger tissue extractions, the doctor will charge a little bit more. But this is very, very affordable.
Yeah, $1,900 is very affordable. I concur.
Yes, and so our goal is to ultimately make the stem cell procedures, which, if you look at the news and people saying, oh, hundreds of thousands of dollars, what you just, commented on. No, we believe that real stem cell treatments using your own cells should be, $10,000 to $20,000 depending upon quantity and how that procedure is performed by your physician.
Outstanding. Hey, tell us about your new laboratory. I noticed there was a press release about a couple of weeks ago, and how's that going, and what's that going to do for American Cryostem?
Well, we were established down at an incubator in the New Jersey Incubator Group in southern New Jersey, and that's a great place to start a business because you get some relief from your costs and expenses. It's a good place to start. You get access to really good and significant resources. And so we grew there from 2009 to 2015, and we started to outgrow our space. We started to generate some revenue. We licensed some technologies to third parties. So we needed a bigger space, and we needed more processing and manufacturing capability. So we moved it north into the Princeton area, which is really the hotbed of pharmaceutical and biotech in New Jersey, and where a couple of our licensing partners have their main facilities. And we moved it north. We got a space about 3 times the size. And that really will allow us to leverage our business and our licensee product sales for the next 2 or 3 years until we outgrow that one.
You know, I don't think my listeners comprehend, if you will, that your stock's at 34 cents. It's completely undervalued in my eyes. I've been in this market space evaluating companies for 25 years. And at 34 cents, that's completely undervalued. On another note, I wanted to talk about recently you guys received a incubator award of the year, and that was from the New Jersey Business Incubation Network. And so what was that for?
Well, we worked very closely with that network and with the BioNJ group in New Jersey, and we started to develop partnerships within New Jersey with large multi-billion-dollar New York Stock Exchange companies to develop products. And so our scientific innovation and our patents and our intellectual property started to spread around New Jersey. We did work with Rutgers and other people in the state, and we were recognized for that innovation because we are truly looking to bring this new biotechnology, regenerative medicine product to the mass public at rates and prices that they can afford, and that's the drive, and we were recognized for that, and it was a good award for us, and it gave us a lot of leverage, I guess you would call it, with accelerating our growth pattern within the state of New Jersey.
My guest today is Tony Dudzinski. He is the COO of American Cryostem Corp under the ticker symbol CRYO. Now, I have another question for you. What is the regenerative part of your business? And tell us a little bit about the personalized medicine also.
Well, I'm sure if you spend any time on the internet or reading the news or watching the nightly news on television or cable, you'll all come across stories about stem cell treatments and the promise of biotechnology to help you regenerate your body as you age, to help you regenerate your body if you're injured or if you have a systemic disease like multiple sclerosis or ALS or these other types of conditions. And the whole scientific group we'll call regenerative medicine and biotech that's focused on what you might call healthy living for well people or for regenerative systemic symptom relief, which means, making you feel better if you have one of these diseases. So we have worked so far with groups on multiple sclerosis and seen people have some improvement in their symptoms for that. We have worked with a regenerative clinic and had people who are generally healthy but, starting to feel their age. They're above 50. They're starting to feel their age a little bit. And, it's a quality of life issue. And
Absolutely. When
when you're using your own cellular material, there's a lot less risk medically in doing that. So these types of therapies and treatments are growing around the world. There are actually clinics springing up around the world that are just focused on giving well people who, maybe are suffering a little bit of arthritis or they have a little bit of a back issue from, being, just working all their life, who are helping them to feel better and be more active and have less pain and have less inflammation through these, systemic, stem cell infusion therapies, which means they just put the stem cells in via an intravenous process.
If you would educate myself and my listeners about this adipose tissue and how do you guys use this service?
Well, adipose tissue is essentially common belly fat. Any fat tissue below your skin on your body. It could be your legs, your belly. We have found that belly fat is actually the best fat to use. And so it's a simple extraction procedure. There's no general anesthetic. It's a local procedure. I actually have had it done twice for the company, just to donate some tissue for scientific study. But it's relatively easy. We have a network of 200 physicians around the country. We refer you to a physician. They make sure that you're healthy and you can have this process done, which 99% of everybody in this country should be able to have it done. And they go in and they use a needle and a syringe, and they just extract about 4 ounces of fat from your midsection. Process takes about 20 minutes under a local anesthetic. They don't even put stitches in you. They just put a Band-Aid on in you, and you go home. And what the doctor then does is he puts that tissue in a box that we've created and patented that allows that tissue to be shipped from his office to our lab overnight by Federal Express. And the next day, depending upon the work order we receive from the physician, we receive the box and we set up your account and we process your tissue, and then we freeze it and put it in a storage tank, and it will stay in that storage tank until some future date when your doctor or yourself request it for a particular procedure or use.
Outstanding. My guest today is Tony Dudzinski. He is the COO of American Cryostem under the ticker symbol CRYO. In closing here, Tony, is there anything you would like to tell our listeners that we didn't get a chance to talk about that you would like to bring forward?
Well, I think that our listeners, and I appreciate you having me here, thank you for your time. I think everyone should start to look towards this regenerative medicine, cellular therapy type business. And I think, in the United States, there's some confusion about can it be done or should it be done. But I think if you spend some time reading about it, and investigating it, there's a lot of people who would be interested in doing it, and we're available. And if you wanted to give us a call, we have our website, which is americancryostem.com. Our phone numbers are there. We would be happy to send you any information you would like about it.
Tony, thank you very much for coming on the show today. Look forward to talking with you in about 2 months, and we'll see how you guys are doing.
Thank you so much, Everett.